This entire segment in the website is devoted to the cervical spine, the neck. The cervical spine has 8 segments, 8 bones, and 14 nerves associated with it, as well as 14 joints associated with it. And it is a very common area of injury in the body, from whiplash to car accidents to falls to sports injuries. The head and neck are a very, very common area to be injured. This can lead to headaches, dizziness, changes in vision, changes in hearing, numbness, tingling around the face, down the arms, loss of muscles, contributes to arthritic processes in the shoulder, as well as things like rotator cuff degeneration. But importantly, all of your neurologic function from your brain passes through the neck, specifically through the upper cervical spine. Instability in that region of the body is very difficult to assess and very difficult to treat. It's what I call a high rent district area. The nerves and blood vessels that go through that area between the head and the rest of the body are very, very tightly grouped together, and this makes it an area that is common and prone to injury, but also an area that's very difficult to treat because of all of the critical structures that exist there. This is something that I've spent 10 years creating regenerative paradigms and protocols, approaches procedurally for, and no other area of the body do I have greater expertise than the neck and nerves associated with it. It's an area that takes a great deal of care, time, patience, and expertise to be able to treat, along with a great deal of education to patients to understand how critical it is to treat each segment. Throughout this part of the website and sections, we're going to talk about the assessment, treatment, the use of different regenerative agents, and full spectrum holistic care of the neck. The neck overall affects the rest of the spine far more than the rest of the spine affects the neck. It's very common for people who have low back problems to also have neck problems. And how many people do you see at their desk like this for 8 hours a day? We even have to the point where we have a new condition called text neck from us being like this all the time. It's a very common, almost ubiquitous problem to have difficulties with the neck. The soft tissue that hold it together and how to restore, rejuvenate that tissue, as well as give that patient the tools to be able to heal and live vibrantly for a long period of time after procedures, is a group of expertise that I have that is very uncommon, and it takes a great deal of experience and interest to wield meaningfully for a patient. I'm going to try to go through about 13 or 14 different pieces of information about the neck, and I hope it's very helpful for people to understand the difference between more entry-level regenerative procedures and the kind of things that are offered at Ortho Cure Clinic, as well as through a full healing program with regenerative masters.